Good
Enter the
afternoon.
room.
My name is Dr. Oluwakayode Komolafe, one of the doctors in this GP surgery. Could you please tell me your full name and your age?
Hi, doctor. I'm Annie Sampson, and I'm 34.
Oh, thank you. How do you wish I address you for this consultation?
Annie is fine.
Thank you, honey. Could you please tell me the reason why you want to see us today?
Well, you see, I have a little bit of an embarrassing problem. I've been having this, vaginal discharge, and it's really itchy down there, and it's been happening for the past 2 weeks.
Okay, I see. I want you to know that this is a very safe place and we are here for you. So anything that you want to tell us, feel free to tell us. Your matter are very, very confidential to us. Now, you said this vaginal discharge started about 2 weeks ago. Is that correct?
Yes, that's right.
Okay, tell me more about it.
Well, you see, it's like a white kind of a discharge, and it causes such terrible itch. I mean, it's continuously there, and I find it very difficult to even sit at work with this kind of a problem.
Oh, I see. Sorry about your condition, but I need to ask you some further question. Is the discharge like cord like? Is it cord like, or how can you describe this discharge?
It's white, it's thick.
Okay, it's thick and white. Is it foul smelling?
Not exactly. Not very foul smelling. But it's not the usual smell that I usually have.
Okay, I understand you. Well, apart from this discharge, do you know that anything make this discharge worse? Does anything make it better?
I'm not sure, doctor, but it's getting worse. I feel such intense itch, especially at night.
Okay.
It's unbearable.
Is this discharge affecting your performance in the bedroom and any other problem?
Not really.
Okay. Is there any problem with the way you pee or poo?
Not really, doctor.
Okay. Thank you. I need to ask you some questions that may seem private, but I want you to know that they are very, very important to your condition. Is that okay with you, Annie?
Okay, sure, absolutely.
Okay. Are you in a stable relationship?
Yes, I am.
Okay. Do you have more than one sexual partner in the last 3 or 6 months?
Yeah. I mean, we've been together for about 2 years now.
Okay. Do you have more than one partner?
No, doctor, just the one.
Okay. Thank you. Do you practice safe sex?
Yes, we try to use a condom every time we have sex.
Okay. All right. Thank you. I will need to ask you some questions about menstrual flow. Is it comfortable with you? Thank you.
Yeah, sure.
When last did you see your menstrual period?
About, I would say, a few weeks back.
Okay. And how is it? Is it regular?
Yeah, it's pretty regular. I have like
Okay.
5 days of menses and fine.
Okay. Do you have excessive bleeding?
No, not at all. Like I use like 1 or 2 pads a day.
Okay. Which contraceptives are you using?
I'm not on any contraceptives. I mean, we use condoms.
Okay.
That
All right.
works.
Okay. Thank you. Let me quickly ask you a few questions about your background state of health.
Okay.
Have you been admitted in the hospital before?
No, doctor.
Do you have any long-term medications that you are taking, if it's oral supplements?
No, doctor.
Okay. Do you have any allergy at all?
Not that I know of.
Okay. All right. Thank you. Do you smoke? Do you drink alcohol?
Well, I don't smoke, but I drink occasionally.
Okay. How about your diet?
Yeah, I kind of have a very balanced diet.
All right. I'll quickly need to examine you, and this will include taking your vital sign like pulse rate, respiratory rate, oxygen saturation. I will need to look into your tummy. Then I will need
Mm-hmm.
to examine your front passage. Is that
Mm-hmm.
comfortable with you?
Sure, no problem.
Okay, thank you. And I will need to carry out certain investigations. I will need to check for pregnancy test. I will need to take blood sample and check for your blood count, markers of inflammations, check for function of liver and kidney. Is that comfortable with you?
Okay,
So,
doctor.
based on the outcome of the investigations of examination and
Two
what will
minutes
be able
remaining.
to discuss, I think you have a condition called vaginal candidiasis. Do you know
All
what
right.
that is?
Not really. What is it?
Yes, it simply means yeast infection. It is caused
Okay.
by small microorganisms. They are small bugs.
Okay.
Now, it is something that is treatable, and what we are going to do now is that I'm going to give you an antifungal called fluconazole. I'm going to give you is just one tablet that you are going to take. Then I will advise that you wear light, loose fitting underwear. Do you
Okay.
understand?
Yeah, I'll keep that in mind. Can you give me something for the itch?
Yes, I'm going to give you some cream that
Okay.
you apply around the front passage, which will minimize the itching. Then I'm going to
Mm-hmm.
give you, if you are experiencing pain, I'm going to give you a simple painkiller with this
Mm-hmm.
antifungal medication. Is going to help you. Are you with me? Then
Okay.
I'll thank you. Then I'm going to give you some leaflets where you can read more about candidiasis. I'm going to direct you
Okay.
to NHS website where you can read more. Then I'm going to give
Mm-hmm.
you 2 weeks appointment to see how you
Okay.
are doing with these medications.
All right. Okay. Sure. That sounds
Okay.
good.
So in summary, you presented with discharge from the vagina, which is whitish and is itching. So we made the
Mm-hmm.
diagnosis of candidiasis. We're going to give antifungal and cream to stop the itching. Is that
Move on to
okay?
the next.
Thank you, Dr. K. Yes, this was a kind of straightforward case. And I would say that there were a lot of unnecessary questions you were asking me. And you were kind of doing unnecessary, tests. Like, why would you do blood tests? Like, what were you thinking? What do you want to do blood tests for? Hi, doctor.
Yeah, because sometimes some people may have certain conditions like diabetes that may predispose to yeast infections. So
Okay,
it's just to have a background baseline investigations.
okay, I see. Okay, but when you're doing that, then it's a good way to explain it. That I'd like to do
Good
some
afternoon.
blood investigations, like check your blood sugars, just to rule out other related conditions. Right, because I wasn't understanding why you wanted to do, the investigations at all. Because at this point, it was pretty clear, straightforward that, it was candidiasis as soon as the cottage cheese kind of thing came. But an important test definitely to do is UPT. Any lady in the, reproductive age group, make sure you do a UPT test, urine pregnancy test, right? And how far into the consultation did you understand that it was candidiasis?
Immediately after like a minute or two, I knew it was candidiasis, but I knew
Okay,
students needed to ask other questions.
All right. So one thing about candidiasis is, do you know the risk factors of candidiasis? You did mention that diabetes could be one of the. Diabetes actually can be a risk factor for any infection. Like any infection you can actually get if you have diabetes, because your immune system is a little, weakened. But do you know other risk factors that you could have asked this lady?
Like douching, care of the
Yes,
vagina, douching. Some people
exactly.
use soap to wash the front passage, which can
Exactly.
alter the.
Excessive use of hygiene products, the douching that you're saying, and also if she is taking any long bubble baths. So these are the risk factors you're supposed to look out for. You asked me a lot of questions which were kind of unnecessary, I would say. Like you weren't able to understand why she's getting this. Right. But you needed to ask the right questions in this case. So you did ask about, if it's, hurting when you urinate or pee and poop if it hurts. That's actually all right. You're kind of ruling out other things. But, you asked a lot of questions on, all the other related conditions, but you never asked why this could have been happening to her. Because one of the management plans you can give is to prevent doing this. So if you've understood that she was taking long baths, which is actually a risk factor for candidiasis. Candidiasis, one thing I need to know is that it's very common, especially in the UK. It is like it's extremely common. So the couple of questions you need to ask is to understand why this patient is having candidiasis. Apart from the immunocompromised reason for having an infection, there are other reasons that could cause candidiasis. You asked about the sexual practice of whether you're using any protection during sex, but there are other things like douching, the how do you wipe yourself, after going after defecating, how do you wipe, you know the other thing is bubble baths, or are you using a lot of hygiene products, because this is why you need to understand why she's having candidiasis in the first place. Apart from treating the candidiasis, you're trying to not have it come back again. Even after this episode was treated, what is the guarantee that it wouldn't come back? It will come back, because she's the reason why she's having is not getting treated, right? So in this case, this lady was actually taking a lot of bubble baths in the tub. So what you need to tell her that this is one of the chances why you can get candidiasis. So I would tell you need to start taking showers instead of long bubble baths, right? So identify the cause as well. But yeah, this time it was all right. So
I'm
let's look
just
at how.
I'm just beginning to understand this exam very well. Before I was just reading, but it's like I now understand what the what how the exam is structured.
That is very true, because that you will only understand this exam if you practice. That is something that we also understood. The first time when we wrote the exam, we didn't pass. We had to write this exam twice to pass. So even we were also just doing that. We had this book that we got from the academies, and then we kept reading, and we thought all we had to do was just vomit out all the information that we had. It's not about that. You need to have a conversation, right? You need to understand why the patient is having this disease and what you can do to prevent them from having it again, to help them with their distress and give them a holistic kind of a management. So yeah, I can totally understand where you're coming from, having written this twice. I mean, having given this exam twice. We've been through that process. All right, so let's see how you did. All right, so patient information, you covered everything, and asked about the vaginal discharge. You started with the open-ended question. Good job. I just said I had vaginal discharge. You asked me, tell me more. So I could tell you that it was a white discharge. So you gave me an opportunity to express myself. So that's a good job thing. And then you started asking, do you have any pain? Is it foul smelling? All that additional questions. That was great. Associated symptoms. You could have asked about the lumps and bumps, because whenever you have an infection, you actually have the surrounding lymph nodes that are inflamed, right? So you could have asked if you have any lumps and bumps, and you could have understood that it could be a systemic examination problem, like, you know, if you have PID and stuff, you might have some inguinal lymph nodes that might have been inflamed. So, you know, you could rule that out quickly. And lifestyle, this is where you didn't ask the right questions. This was a very important point which you missed out. The use of bubble bath, vaginal douching, shampoos during bathing, or any intrauterine devices, because that's the reason why she's having it, right? So that's the main point of treating this kind of condition. Apart from treating the infection itself, you're treating the cause for the infection as well, which is very important, right? And then menstrual history. Actually, I'll give you a yes for this. You actually asked me the menstrual history. And then, right, Candidiasis is the most likely diagnosis. What is it? It's basically yeast infection, which is basically a fungal infection. I think that would be enough, because if you say yeast infection, I think people understand, because yeast is something, especially in a country like UK where bread is so common, they understand what yeast is. So, you know, you have to talk in a way where it would be, you know, conceived in the way that you want by them. So just saying yeast infection is actually good enough. Like, and most of the times people, since this is a common condition, you might actually have the patients, yes, I know what it is, right? So when a patient says, yes, I know what candidiasis is, then what would be your reaction? Your reaction would be, would you want me to explain any further? Right? And if they say no, that's good for you. You don't have to waste time doing that, right? So when they say, yeah, I know it, then I'm like, all right, sure, that's good. Do you want me to explain any further? Then they'll say yes or no, and according to that, you can ask, you know, explain it further, saying this is a yeast infection, which is a fungal infection, right? So that's why you're giving antifungal creams. So if you had used the word that yeast is fungus, that would be more, you know, better, because you're telling them that I'm treating you with antifungal. Sometimes the patients, they might not know that yeast is actually a fungus. Right. So any doubts you think that the patient can have around the disease and the kind of treatment that they are getting, you need to try to, you
I
know,
shouldn't have said I'm giving you antifungal cream, antifungal
yeah,
drug. So what should I have
yeah.
said?
No,
What?
you that was correct. I mean, it was good that you said antifungal, but I'm saying that I might not, as a lay person without any medical background, I might not know that yeast is actually a fungus. Probably people in the UK know that yeast is used to make bread. Like, that's common knowledge, but yeast being fungus might not be that common a knowledge, right? So you can just offer up that knowledge, like you have a yeast infection, which is a fungal infection. So I'm going to give you some antifungal creams. That's good enough. So that way I'll understand that, oh, okay, fine, it's a fungus infection that I'm getting. All right. So you're giving me antifungal cream. So basically, I'm telling you such that, you know, if you come down to the level of what the patient understands, then they will also be able to, you know, if you have to communicate, like most of the times when you have a STI, you have to communicate to your partner. Right. So if I have to say that I have yeast infection, the first thing they'll say is, what is that? It's like, it's a bug. That's the first thing I'll say. Like, all right, it's a bug. But antibiotics can be like for all sorts of bugs. It could be antibacterial, antifungal, antiviral, but you're giving an antifungal cream. So you can give an extra information saying that it's a fungus. It's a fungal bug. So that way, if I'm even having to, for a patient itself, if you think about from a patient's point of view, if I have to talk to my partner about the fact that I have an, you know, infection down there, I probably say that I have a fungus infection. So that will be better communicated. You know, you're trying to be keeping them as educated as possible, like with simple words that they can understand and communicate with others. I mean, that's my personal opinion, but definitely everybody has a take. So, right. So you did prescribe cotrimazole, and you explained it as a antifungal medication. But I'm sorry, you prescribed fluconazole, right? Initially, you were supposed to be also giving cotrimazole cream. So
Yes,
always give the
I'm
cream.
going to add cream to it to prevent the itching.
Yes. Antihistamine. Did you mention antihistamine for the itching?
No, I said creams that we rub on the front passage to prevent itching.
All right. Okay. Okay. Sure. That works as well. But it would help you to get more marks if you say the word antihistamine, because
Okay.
even though you are talking to the patient, there's always an examiner at the back who is trying to mark you on your management, right? Like, did you give antihistamine? Did you give this? Right? You can just say
Okay.
antihistamine just so that they mark you on that point, right?
Okay.
So, I don't think we've added that point, but I'll try to add that as well. So antihistamine for the itching, and a fungal cream for the what we'll say the
The
infection
fungal
itself, to
infection.
control the infection. And we can also give you an oral cream that can help, because the importance of the oral cream is, if it is a systemic infection, it's better to give an oral medication. But you saw there was much of a systemic sign, right? But since she's been having it for about 2 weeks, that makes sense, because this has been there for a long term, right? So long term itself, you will have to treat it a little more aggressively. And then leaflets, pamphlets, yes, you did say that, so I'm going to give you a point for that. And follow-up points also, you said. And yes, safety netting you have to give. Like, if it did not resolve in the next few days, if you're having more intense itch, make sure you come back to us so that we can prescribe you something stronger. Right? So safety net, think about how it can be worsened. Like, anything that you can think about, like, why would it be worse? So then add that point in. So okay, so you didn't ask ice. So if you had asked ice, my first idea would be that to say, is it cancer? So it's very important to ask eyes, because you need to understand what they are thinking, so that if they have any misconceptions, you can clear that misconception. This was a misconception this lady was having, which I couldn't tell you because you didn't ask me that question. So it's always important to have an idea of what this lady is having. So, like, what do you think it is? Like, do you have any idea what it is? So my response would be, is it cancer? Is it because it's been there for a long time? Is it cancer? You know? So so another thing, that if I had said that if I had cancer, what is the next thing that you would ask me? Ideally, if you think that I have a cancer of the cervix, what is the thing that you should ask me?
In postcoital or intermenstrual bleeding.
Not really, because I'm scared of cancer. One thing that you should ask me is, did you go for your cancer screening, cervical cancer screening? Did you get a pap smear? So if she is scared of cancer, we need to understand why that scare is. Because in the UK, as soon as you turn 24, you get a letter to come and get pap smear done. So why she's scared of cancer? You could have actually asked, have you got a pap smear? Then my response would have been, no, I've never gotten a pap smear. So the conversation could have gone like that. So whenever you think about vaginal, anybody who's scared of cancer of the vagina, I'm sorry, the cervix, then think about the pap smear, because this is something that is routine screening that is done in the UK. So yeah, whenever that question comes up, the first thing your mind should go into is, why is she thinking of cancer? If she is thinking of cancer, has she done the pap smear? All right. So, but that's all right. It's always a learning process. But always try to ask ICE, because that will uncover so many different things. Right? But good job, not bad. You did pretty well in this case as well. Right. So we will do one more case and then we'll take a break. How does that sound?
Okay.
Okay. So
Please like and subscribe to Turing Med School. Good luck with your preparation.